Reminder to everyone who is not speaking to stay on mute until our question and answer session. Thank you for coming to the April 8th Sacramento County Public Health COVID-19 media briefing. I will pass it off to Dr. Olivia Cassirier to provide us with an update on current COVID information.
Good morning, everyone, and thank you again for joining us. So just to start off with a brief update of where we're at with the numbers, we have 99,157 cases of COVID-19 reported to Sacramento County and 1,627 deaths. We are averaging about between 100 to 150 cases on a daily basis, and our 7-day average is 8.6. Looking at the blueprint update that was given yesterday, the case rate, according to the blueprint, is 9 per 100,000. Over the last couple of weeks, there was a time when we started seeing an uptick in the numbers, and there was also some delayed reporting, which contributed to the case rate being as high as it was. But it is now has gone down to 8 per 100,000 again. We are seeing a plateauing of the cases, and that is going to delay our ability to be able to move into the orange tier. The state yesterday also made two major announcements. We reached a major milestone where we got to the point of 4 million vaccines being given in the health equity quartile. And that marked a change in the threshold for the orange tier. So the threshold now is at 6 per 100,000, but we're still at 8. So we still have 2 more points to go down before we're able to meet the criteria. The governor also made a major announcement that with the expectation that the hospitalizations remain low and that there is easy access to vaccination for every eligible Californian, that come June 15th, that we will basically put aside the blueprint and we will go beyond the blueprint. There will still be some restrictions, and we will continue providing guidance in terms of for individuals, continuing to use face coverings and 6 feet separation. But the blueprint will go away, which means that the state health officer order and the county health officer order will end at that time. Of course, that will be dependent on the 2 factors, easy access to vaccination as well as low hospitalizations. So we will continue to monitor that, but that is some at least welcome news to a lot of people who have been asking when we will be able to get beyond the blueprint. So with that, I am going to turn it over to Rachel Allen to talk about the immunization status.
Hi, good morning. I'll just give you a brief update on our allocation numbers this week and a little bit more about a program that we're doing here. So last week, the projection that we received from Blue Shield showed the next few weeks staying flat, the allocation staying flat. Unfortunately, when the numbers came in, they're quite reduced this week, and I think it was a surprise even to Blue Shield, but the whole entire state received less vaccine, I believe around 400,000 doses fewer than the week before. So our allocation here for public health and for our providers is 20,200 doses. You'll remember last week it was 33,000, so pretty significant reduction. I don't have the exact breakdown. They're still working on the final numbers with Blue Shield, and they'll get those to us today, but it looks like the biggest reduction is with the Johnson & Johnson. So it's going to be challenging on a week where, we know next week eligibility is opening to 16 and over. We really did hope to have an increase in the allocation, so it will be challenging. Again, we're just asking for patience, and we will make sure to get doses out as quickly as we can. And then hopefully a bigger bump next week. They continue to say that mid-April is when we should see an increase in the allocation. And we are still working jointly with Blue Shield to make allocations, and it looks like that process will go on for the next few weeks. It's taking some time to contract with all of the providers. So they continue to allocate to the providers that have signed contracts with Blue Shield, and we're continuing to allocate to those who they have not yet been able to get contracted, but they're working on it. And so nothing changed in eligibility this week, but of course, next week, April 15th, we do open to 16 and over. And again, just a reminder that 16 and 17-year-olds currently can only be vaccinated with the Pfizer vaccine. And in a moment, I know my colleague Hannah will go over our website to kind of show you how people can differentiate where they can get that. I did want to speak to the increased requests we're getting for homebound patients. So for the last month, we have a small strike team here, and they've been going out and vaccinating care home residents, so leftovers, people who didn't get their second dose through the federal pharmacy partnership. And they've been starting to do a few homebound patients. We just have the one strike team, so that we've been taking patients that have been referred to us. And we also work with a few pharmacies and outside providers, especially if a patient needs something unique, like just a single dose for a second dose of Pfizer. It's not that easy to just have a single dose handy. And of course, we have to be careful. We have to use all of the doses within 6 hours. So sometimes we'll reach out to another provider, but we have been able to respond to those requests, but they appear to be increasing. And so we are working on developing a plan for that. We have limited capacity right now, but do see it as an increasing need and absolutely plan to respond to that. So we'll have some information in the weeks to come on how we plan to be able to serve that population. I'm going to turn it over to Hannah Alborg.
Hey, good morning, everyone. And I apologize if you hear any background noise. I am coming to you live from the Cal Expo site. So I just wanted to give a quick update and provide some insight and share some of the highlights of the public health vaccine website that we have for the community. As eligibility for the COVID-19 vaccine opens up to the Sacramento County residents, we would like to ensure that the community can navigate our website for the most up-to-date information. One of the things that we want to do is encourage the public to continue to visit our website frequently, as information can change several times just even throughout the day. It's a daily thing, but sometimes information can be posted hourly, or information can be changed, as we have been working with our community members and our hospitals for pop-up clinics and being able to utilize the vaccine that we have and get the shots into arms. Currently, the website is broken down into two main sections: eligibility and vaccination clinics. As Rachel just mentioned, starting April 15th, the state is opening up the eligibility to 16 and older. So I'm just gonna focus on the vaccination clinic section. Currently, the section has distinct separated categories. We have walk-through, drive-through, retail pharmacies, and medical providers. For the walk-through clinic and drive-through clinic categories, the type of clinic will include the name and the location of where the vaccination appointments are available and what type of vaccine is being provided. We also try and include any type of special instructions or information specifically for that site. One thing I can say is, for example, under drive-through today, we are able to do a special Johnson & Johnson clinic on April 9th and on April 12th. So it says that after the name, and people can just click on the Cal Expo link and sign up for available appointments for Johnson & Johnson. Under the retail pharmacies and medical providers, we've included direct links to their website to find out more information on how to schedule appointments through those entities. There's also a link on there for Vaccine Finder. Vaccine Finder is a tool that's operated by Boston Children's Hospital, but it's supported by the CDC and nationally. So you can utilize Vaccine Finder to help you find clinics, pharmacies, and other locations that have been uploaded into the system for COVID-19 vaccine, not only for Sacramento County, but throughout the state and throughout the country. And that information is updated daily. The one thing Vaccine Finder does not do, it does not allow you to book appointments through Vaccine Finder, but it will show you the locations that have available vaccine, and then you can then utilize that link to click there and then be able to schedule an appointment through that website. So, and again, please keep in mind that the COVID-19 vaccine is still very limited. And as Rachel mentioned, we're hoping that the vaccine supply will increase sometime towards the end of April, early May. But please, everyone, just keep your patience and please continue to check the website frequently as there's appointments available all the time. Thank you. Oh, I guess I'll kick it over to Jamie White to give a surprise announcement to the group about Sacramento.
So I know you guys have been waiting for more information about South Sacramento sites, and we continue to have those pop-up locations that Mike has provided lots of information about previously. We have initiated talks with both Consumnes River College and Seritage Florin Mall, located in the 95823 zip code. We will be pursuing facilities agreements with both locations, the process for which can take some time. But once those contracts are in place, we will be working with one or more providers to run those clinics. And the scope and the frequency of those clinics will depend on the provider availability and also our vaccine allocation. That's it. That's all for me.
Okay, thank you, everyone. So now we can move into our question and answer session. We have quite a few outlets on the meeting. So if you can either utilize the hand raise feature in Zoom, or I'll keep an eye on the chat if you don't have the hand raise feature. Then we also have a couple outlets that are strictly on the phone. So we will work them in as we can so that everybody gets a chance regardless of what medium they're using. So first up is Chelsea Shannon from ABC 10.
In terms of the Johnson & Johnson vaccine and the potential decrease this week, how will that affect the efforts going forward with the April 15th date? Could you elaborate on that?
I mean, like I said, it's going to make it challenging. I mean, the clinics that we have planned for next week are fairly funded with vaccine. We have to kind of plan out a week, but the following week. So I think April 15th is a Thursday. And so, you know, that Thursday, Friday, and then into the next week, we may not have, we're not going to have, we already knew we weren't going to have enough doses for everyone in that population. And now it will be a bit more challenging. And I think, again, just reminding people, doses will increase. We know it's coming. Please be patient. And, they can access the website and try to get an appointment there.
Renee Santos from CBS 13.
We have variants in our region that have been detected. I want to know what the concern is here in Sacramento County. How hard is it to detect these variants? Where do we stand with detection as far as sequencing? But what are the biggest concerns right now with variants popping up in different parts of our region?
I'll start it off and then see if Jamie would like to add to it. But yes, we are concerned about variants. The state is monitoring and does send us information if there are variants detected either in neighboring counties or within our county. We do have criteria that we follow when we are requesting for sequencing, because right now we're not doing it at our public health lab. We have to send the specimen over to the state. And usually the criteria include someone having symptoms, someone who is already fully vaccinated, coming down with COVID-19, or someone with very severe disease. Those are some of the criteria that we use, or someone who is getting COVID-19 for the second time. Those are some of the criteria that we use to determine when to request for sequencing to be done. So yes, there is some concern, and that is the reason why we continue to ask that everybody continue to use the face covering, hand sanitizing, and use a 6 feet separation, because those are ways that will continue to protect even those that are not vaccinated.
How often are you seeing that tests are being sent to the state for sequencing? Is this something that's happening often now, or it doesn't happen as often?
It's not very often at this point.
And I can add so far that we've been notified of 11 cases of the new variants, either the UK variant or the West Coast variant.
Specifically in Sac County?
Correct.
11, okay. Thank you.
Okay, Chelsea, you have a follow-up question?
Last week we discussed, or it was asked about breakthrough cases. I was just wondering if there's an update on that data. And also if we, going into the next week, we see it, the CDPH reports a rise in case rates again. Will the county be concerned about going to the purple tier or still staying with the idea that we're plateauing?
Jamie, do you want to address that? The breakthrough, I think your first one was breakthrough cases, and then also where we think we're going to be next week, correct? So Jamie, do you want to take those?
Yeah, so I think we sent you everybody on the call, some data about the number of cases among vaccinated individuals. Unfortunately, a lot of that vaccine information is missing from our case reports. And so I think it was over 80% of it was missing. And we would expect that they would be like differentially reported. So people who have been vaccinated and then get COVID, they'd probably be more likely to say, hey, I've been vaccinated than someone who had not when you're interviewing them. But I don't really have any updates to the data that we had provided last week. I think it's pretty steady so far.
And then as far as for next week, looking at our dashboard, we do provide information on a daily basis on what our 7-day average is. And it's been running steady around 8.5 per 100,000.
Yeah, we're going to be optimistic and say it'll hold steady.
I have a follow-up question from Renee.
Yeah, my question pertains to vaccine distribution. We've seen areas like Stanislaus and UC Davis open up to 16 and up. We still haven't gotten to that point yet. But are there any potential ramifications with other areas already opening up? Are there any concerns, especially with the lack of supplies? And then do you see this as potentially those 50 and up aren't getting the shot? There's more vaccines available to them. What are the concerns right now, or if there is any?
I can start and then I'll let Rachel add to that. The biggest concern we have right now is that we have a limitation in the vaccine available. And as Rachel mentioned, with the eligibility expanding next week to include those 16 plus, that just adds to the number of people who are looking for appointments. And as Rachel mentioned, also Pfizer is the only one that will be available for those 16 and 17. So I think that a lot of people will be looking for those clinics that are providing the Pfizer vaccine, especially if they're looking to vaccinate school children. But right now, as again, Rachel mentioned, whenever we get our weekly allocation, we do make sure that we reallocate it to all of our providers and make sure that we use it up in the week. So Rachel, if you have something you'd like to add.
Yeah, I would just dovetail onto that. We can't really control what other counties do, and every county has different demographics and different challenges and advantages or disadvantages. And the only thing, and we don't have control over the number of doses that come to Sacramento, but the only thing we can control is getting them out as quickly as possible to providers that we know will get them out to the right population. So, and every time eligibility opens, it creates a big surge of eager people that really want to get vaccinated. So this is not new to us. We know that there's going to be another big surge coming, and we're just going to work as hard as we can to meet that demand. And our providers know it's coming. We meet with them weekly. They understand, and they also understand how important it is to use the doses that they have in the week that they have them, and not to hold on to them. So I think the part that we can do something about, we're doing, and then we are always hoping for more vaccines. So, and that will be a great day when we have enough vaccine to make this happen for everybody.
Are we seeing a big demand overall, despite age and health conditions and whatnot? Is there a huge demand for vaccine?
That continues.
Yeah, go ahead, Dr. K. I would say, yeah, we're still seeing, when we do have providers set up clinics, and sometimes they'll say, oh, my clinic's not full. They email Stacy, she puts it on the website, and usually within the hour it's full. So I think there's still a lot of demand right now from what we're seeing.
Chelsea?
Would it be possible that the vaccine allocations, when you do get them finalized, that you could send them out to us?
You mean the exact numbers? You know what? I do have it. It's just that when I pulled it up, it wasn't making the right number. So hang on.
They're also posted on Fridays on our vaccine dashboard.
Okay, yeah, so it's 11,700 Pfizer, 6,800 Moderna, and 1,700 Janssen.
And I can include those numbers in my follow-up email that has the link to this video recording as well. And then as Jamie mentioned, they're posted on our dashboard every Friday. I don't currently see any more hands raised on the meeting. Is there anyone on the phone that has a question? Speak now. Okay, I do not hear anyone. So if there's no follow-up questions from the rest of the group, then I'll go ahead and end the meeting. As a reminder, I will send out the full recording of this meeting within the next few hours. I will also include the link to the website that Hannah went over that has all of the different clinics, pop-ups, and other information about accessing vaccines, as well as the allocation numbers for this upcoming week. So thank you guys for joining us, and we will see you next Thursday.